Hey everyone, today we're tackling a really important topic: how to know if you might have a heart blockage, also known as coronary artery disease. Now, before we dive in, just a quick note: only a qualified doctor can make a proper diagnosis, but knowing the signs, the tests, and when to take them seriously could literally save your life. Let's break it down. First, what does a heart blockage feel like? Heart blockages don't always come with dramatic warning signs. Sometimes the symptoms are subtle or brushed off as stress, indigestion, or just getting older. But here's what you want to look out for: chest pain or pressure, especially with exertion or stress, shortness of breath, even with mild activity, unusual fatigue, sweating that feels out of place, nausea or lightheadedness. For some people, especially women, symptoms can show up differently. Things like upper back pain, jaw discomfort, or even sleep disturbances can be signs of a heart issue. Step 2. See a doctor. Don't wait it out. If you're having any of these symptoms, even if they come and go, get evaluated. Your doctor will start with your medical history, risk factors like smoking, diabetes, or family history, and a physical exam. From there, they'll run tests to look deeper. Key tests to detect heart blockage: 1. Electrocardiogram, ECG or EKG. This is often the first test done. It measures the electrical activity of your heart. It can show past heart attacks, rhythm problems, or signs of poor blood flow. 2. Blood tests. If there's concern about a recent heart injury, like a heart attack, your doctor may check for markers like troponin or CKMB. These proteins leak into the blood when the heart muscle is damaged. 3. Echocardiogram. This is an ultrasound of your heart. It shows how well your heart is pumping and can reveal structural issues or areas that aren't getting enough blood. 4. Stress testing. This can be done on a treadmill or with medication. The idea is to push the heart a little to see how it responds. Sometimes problems only show up under stress, like hidden blockages that don't cause symptoms when you're at rest. 5. Coronary CT angiography, CTA. This is a non-invasive imaging test that uses a CT scanner to get a detailed look at your coronary arteries. It can spot narrowing or blockages without going inside the body. Bonus tip: if you're not having symptoms, but your doctor thinks you might be at intermediate risk, they may recommend a coronary artery calcium Haight score. That's a special kind of CT scan that checks for calcified plaque buildup in your arteries. It doesn't involve contrast or dye, and it's a quick, low-radiation test. It's not for diagnosing blockages in real time, but it's great for predicting long-term heart disease risk, especially before symptoms ever appear. 6. Cardiac catheterization, angiography. This is the gold standard for detecting blockages. A thin tube is inserted through a blood vessel, usually in your wrist or groin, and dye is injected to see the blood flow in real time. If there's a significant blockage, treatment like angioplasty or stenting can sometimes be done during the same procedure. The bottom line: heart blockage doesn't always hit like in the movies. It can build slowly, quietly, until one day it becomes an emergency. That's why if you're having symptoms or if you have risk factors like high blood pressure, high cholesterol, diabetes, or a family history of heart disease, you should take it seriously. Early testing can catch problems before they cause a heart attack, and treatment can be as simple as lifestyle changes, medications, or a minor procedure. Don't wait for it to get worse. Listen to your body. If something feels off, get checked. Thanks for watching. Take care of your heart, and I'll see you in the next one.